Dr. Geisler, when one talks about a shoulder replacement, what are the options available?
Thank you, Jeff. There are several options. This happens to be a model of a shoulder. And when we talk about arthritis, what we're talking about is the loss of articular cartilage to the joint surface. So when that occurs, there are lots of options available depending on the patient's age and their physical demands. For example, one option is called the Hemi Cap, which is what this is here. And with that, you're reaming off the articular cartilage, and this goes on top. The advantage of this is to not take away very much bone stock, particularly if you have a fracture into the stem, an old fracture that prevents you putting down a stem into the bone, then this certainly is an option. It's generally reserved for more younger patients as compared to older. The other option next is what's called Hemi Arthroplasty, and that's basically replacing one side of the joint, generally the humerus. So in this situation, again, the bone is cut, and the stem goes down the center of the bone, and one side is replaced. That's called Hemi Arthroplasty. Then you have total shoulder arthroplasty, where you're replacing both the humerus and the glenoid. So on this model, what this demonstrates, again, you cut off where the bad arthritis is. The bone is hollow, and you take a stem the same size as the patient, so you very much customize it for that. The stem goes down inside the center of the bone. You pick the head the same size as the patient. And in this instance, now you're replacing the glenoid with a plastic component, and then the shoulder is reduced. So that's called a total shoulder arthroplasty. And that's generally for more older patients for that type of procedure. And then for very bad shoulders where there's no rotator cuff, then you do what's called a reverse shoulder. And so with that, just like this model, the head, or the round part, the spear, goes onto the shoulder blade side. And the cup, again, we cut off the arthritis, the stem goes down the center of the bone, the cup goes on the humerus side, and then it's reduced in this manner.